It's great to have you on the program. So this is what we've seen. We've seen this peak in daily vaccination and then a decline. Now, that's understandable, partly because of the dynamics of demand here and supply. But right now, we're sort of coming down into this range where we're headed towards 500,000 a day. What does today's announcement mean in a practical sense? What changes today to arrest that decline to get us those 16 million shots in the next month?
Good evening, Chris. Thanks so much for having me. First, let's just celebrate this extraordinary time where we have 3 very safe, very effective vaccines, and we have enough of them. They're distributed in all corners of America now to be able to give to the American people. So this is going to be a huge push through the month of June to reach that 70% threshold, and that means America working together. That means faith-based organizations and community-based organizations and businesses and athletes and celebrities and really everybody chipping in to do their part to make sure that we can reach people where they are.
Is that so? What am I hearing is that that this is a messaging push as opposed to an infrastructural push. Like the vaccines are out there, the infrastructure is there in a physical and logistical sense, and you think the obstacle here is essentially messaging.
I think it's actually a push in all directions. We are pushing at the infrastructure. We're trying to work with businesses to make sure that that folks have time off. There are lots of businesses that are giving people time off. We are putting in mobile units and pop-up clinics to reach people where they are. We have trusted messengers in all corners of the United States. So not only is it messaging, but it's making sure that we get to the people. We understand why people may not be, rushing to get the vaccine now, and understanding that will help us deliver them the information that they need so that they might want the vaccine tomorrow.
Yeah, I'm glad you mentioned a day off. There's a very good piece in New York Magazine by Sarah Jones where she just interviewed folks who had not gotten it or were delayed. And one of the things she said is, she cited the Kaiser Family Foundation poll and found this in reporting. Half of adults who've not been vaccinated say they're worried about missing work because of side effects. The problem here is pervasive inequality, not misinformation about vaccines. There are tens of millions of people, I think, who are just worried that, that second shot, it knocked me out for a morning. I was kind of laid up. I did my show that night, but, I was lucky enough to have that scheduling flexibility. Are you, as the head of CDC, would you like to see employers give people a day off if they need it to get that shot?
Absolutely. And the day off to, if it's inconvenient for them to get it during working hours, to actually get it. And if they're feeling unwell the next day, the day off to make sure that they're feeling better and can come in the next day. We're working with employers. We're working with child care centers so that you have access to child care if you can't take your kids as you're trying to schedule your vaccine. So we're working in all sectors of the United States to make sure that people, the reasons that people may not have gotten the vaccine already are no longer obstacles for them. And that may be everything from I can't get there, Lyft and Uber can help you get there, to I don't have access for childcare for my kids, to I can't get the day off, I need help scheduling. So really in every single way, we are trying to make it easy, and we're trying to give the information that people need. I really don't understand how the science moved so quickly. We'll give you the information to understand how that happened as well.
All right, I want to talk about the international context right now. I don't have a good picture of the concrete number. You guys in the administration have done an amazing job of tracking the numbers on doses, on their administration. The CDC webpage for this data is way, way better than it was. How many doses have we shipped internationally? Like, do we have a number for that? What have we actually put out into countries, physical doses to put into arms across the world?
So the first thing I want to just convey is we very much understand and embrace no one is safe until everyone is safe. And the president re-entered the WHO on his first day of his presidency, and we are engaged globally. We have a commitment and a plan to share 80 million doses of COVID vaccine by the end of June, and we're working through the logistics of that plan. And what I would say is that's really 5 times more than any other country. Over the weeks and months ahead, what we really would like to demonstrate is the United States not only is sharing, but is also working to increase vaccine production here and increase the capacity for vaccine production across the United States.
Respectfully, honestly, like a plan is not enough. I mean, people are dying every day across the world. You know that probably better than anyone. You're living this full time. Like the test for the administration when it came in a domestic context was like how many shots you get into people's arms. And the clock was ticking. And to the credit of the administration, frankly, your administration moved very quickly to get shots in arms. It feels like the same urgency is not there. I've been hearing 80 million doses. I've been hearing we're working through logistical issues. Weeks and weeks have gone by and we haven't shipped doses.
Yeah, I want to be very clear to say that we have been, first of all, here in the United States, to this day, we have suffered the most deaths of anywhere in the world. We needed to put on our own oxygen masks before we were able to help others. And now we are actively doing that. We are engaged at CDC specifically with 60 other countries, and we have been working not just in deploying vaccine, but in deploying technical assistance and deploying and training people on the ground, in doing investigations, and also in the work that we will need to do to provide vaccine support once we have those vaccines. So it's not just the vaccine that we're needing and wanting to supply, but also the technical assistance that we are, providing to many corners of the globe.
So I'm totally open to there being complexities that I'm not understanding. So I'm trying to get to the bottom of what I'm not understanding, honestly, because there's tens of millions of AstraZeneca doses sitting somewhere. They're not going into arms. There are people dying by the day in India and Nepal. And I know things are more complicated than like, just get them the doses. But why? Why are they more complicated? Why aren't those doses in people's arms?
So we are working as an interagency to make sure that those doses can get out of the United States. We're working closely with the FDA to make sure those doses can safely get out of the United States, and we've secured a plan for how they will be distributed.
Are you confident that we are going to see the curve that we've seen in this country happen in other countries this year? There's been worry that we're looking at this extending into 2022, but we're seeing what mass vaccination does. We've seen it in Israel. We saw it in the UK. We've seen it in our own country. Are you confident we're going to see more countries follow that trajectory, that sort of downward de-exponential curve in the next 6 months?
I don't think we as the United States are going to be able to cover this around the world alone. I think that what we intend to do is set an extraordinary example for how we want others to work with us to provide the same in-kind support and donations. We as United States want to set that example. And with that example and others leveraging their resources as well, I think we can bend the curve. It's going to take some time to do this around the world.
All right. Dr. Rochelle Walensky, who has a very, very difficult and very, very important job at the Center for Disease Control. Thank you so much. Come back on the program anytime. I really appreciate it.